Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 71-year-old patient with neurocognitive disorder due to Lewy Body disease presents for a routine follow-up. His wife reveals that he seems to be hallucinating, sometimes at night, becoming very agitated as a result of visual hallucinations, and she's afraid for his safety. The patient himself doesn't really seem to understand that there is a problem, but his wife is very concerned and firm that he seems to have visual hallucinations more and more frequently. Which of the following medications would be most appropriate? So this is a pretty simple principle, one that you definitely want to remember for your practice and certainly one that you want to remember for your boards. If you have a patient with visual hallucinations, or really any hallucinations, but visual hallucinations are most common, a patient with Lewy body disease who is having hallucinations, they tend to be particularly sensitive to antipsychotics. So the question here is, which of the following medications would be most appropriate? Risperidone, Olanzapine, Haloperidol, or Quetiapine? Again, a pretty simple, straightforward patient management question. I mean, this is a pharmacology question. Which drug is most appropriate in this circumstance? And of these four answer choices, D is the best option. D is the correct answer. Patients with Lewy body disease are particularly sensitive to antipsychotics and particularly vulnerable to significant adverse drug effects. That's why it's so difficult to manage them for psychotic symptoms. They appear to actually have a worsening of motor symptoms when they're treated with anti-dopaminergic medications, which virtually all antipsychotics are. I mean, remember, the mechanism of psychosis typically is too much dopamine binding at D2 receptors in the mesolimbic pathway. Psychotic symptoms generally are believed to be a consequence of too much dopaminergic activity. So almost all antipsychotics, virtually all antipsychotics, one way or another, whether it's first generation, second generation, even the third generations like Abilify and Rexulti, all of them appear to have some anti-dopaminergic property. So what do you do in a patient like this? Well, number one, I mean, ideally, we don't love to use any antipsychotic in a patient with Lewy body disease, but as you may well know, sometimes it's really necessary. So while no antipsychotic is particularly desirable in Lewy body disease, for whatever reason, quetiapine appears to be better tolerated and have a lesser adverse effect profile than other antipsychotics. So when an antipsychotic is absolutely necessary in patients with Lewy body disease, and sometimes it is, absolutely, when it's necessary, quetiapine is considered the first-line approach, the first-line drug therapy, has been for a very long time. Ideally in lower doses, best bet, less than 50 milligrams a day. I mean, we can start as low as 6.25 milligrams a day, but escalate as necessary, trying to keep it below 50. But of your typical garden variety, when I say typical, I don't mean first generation. I mean, of the antipsychotics out there, quetiapine is generally considered the best bet. And of these four answer choices, absolutely quetiapine is the best bet. Another option on a side note is pimavanserin, which is marketed as Nuplazid. This is an antipsychotic that's approved for the visual hallucinations of Parkinson's disease. It's not indicated for Lewy body disease, but it is used off-label due to its unique mechanism of action. The mechanism of visual hallucinations in Parkinson's disease is believed to be rather different than the mechanism of most hallucination conditions. And so Nuplazid, its mechanism of action is totally different. It targets the visual cortex in the brain, and it's just a whole different mechanism of action. And so that is another option you can try off-label for Parkinson's, or rather off-label for Lewy body disease. It's just that, in practical application, getting it approved by the insurer for an off-label indication isn't always easy. So those are different practice nuances that, you will pick up when you finish school, get certified and all of that and go out into practice. But the principle that I really want you to take away from this question and carry to your boards, a principle that you will very likely be tested on, is if you have to use an antipsychotic in the patient with Lewy body disease, which one will you use? And the answer is Quetiapine.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.